Time for Ask It Early. Our Dr. Jennifer Ashton is here to answer some of the questions that you have sent on Twitter and on your webcams. Good morning again, Doctor.
Good morning, you guys.
Very exciting. We have a viewer on her webcam this morning. She's in Atlanta, so let's get right to Catherine. Hello, Catherine. What is your question?
Morning.
Good morning.
I'd like to know if you think that all new mothers should be screened for postpartum depression.
Absolutely, they should be screened. This is something that affects about 1 in 10 of new mothers, and it really needs to be destigmatized.
Let's just, in case people didn't hear her question,
So,
should everyone be screened for
Should
postpartum?
everyone be screened for postpartum depression? Obviously, women who have just delivered. The answer is overwhelmingly yes. It should not have the social stigma. This is not about being overtired or a little moody. This is really a medical problem, and it can have some significant consequences to both the mother and the baby. And so the sooner it's identified, the sooner it can be treated. And those treatments can include everything from medication to talk therapy to even things like yoga. It's very important. Great question.
Good question. All right. We have another question from Adrian, who says, I am pregnant and have come in contact with someone with the flu. What do I need to do? That's a good question.
Very important. So first thing is, and I actually answered this to her on Twitter, communicate with your obstetrician immediately. Just because you've been exposed to someone who may have H1N1 or regular flu does not mean you yourself will get sick, but we know that pregnant women are at a much higher risk of serious complications, and early treatment with things like Tamiflu, if you were to develop symptoms, is very important. So,
and it can be done? You can do it?
Absolutely.
All right.
All right, next question also from Twitter. She wants to know, Farf's girl wants to know if there are breast cancer testing options for women under 40.
Sure. So the first thing is that a good family history really needs to be taken by a doctor. If you have a first-degree relative, which is a mother, a sister, a daughter, who's had breast cancer at an early age, generally we start screening that person at 10 years earlier. So that means if someone was diagnosed at 40, they start getting screened at 30 with mammograms, things like MRI, ultrasound, and there's a genetic blood test called BRCA. If you have a strong family history, that's very important.
So the tests are the same. You just start earlier if you have a family history.
Exactly.
But here's the question. So many people are concerned about it. If you don't have that connection, are there any options really available?
Nothing that's generally accepted by the American Cancer Society. But again, prevention is key, healthy lifestyle, and knowing your family history is probably the most important.
Self-exam. All right. Also, finally, Jonathan wants to know more about food supplements. He is on the web. Good morning, sir.
Good morning. Hi, Dr. Ashton.
Hi,
Thanks
Jonathan.
for taking my call. I was very interested to know what you can tell Americans about how to get high-quality food supplements. I mean, many people are told by their doctor, for instance, to take a fish oil supplement for their lipids, but there are more than one choice. There are many choices. What can you tell Americans about finding the right supplement for them?
Jonathan, thank you.
Excellent question. First of all, the supplements and vitamins are not regulated in exactly the same way as we regulate medications. So you do need a little bit of the buyer beware. It's not always correlated with cost. So the highest cost items are not necessarily the best. You want to go for something that has a seal. There are two seals that we tend to look for. One is called the United States Pharmacopoeia, and that's kind of a judgment about purity and quality. It's as best as we have right now. In terms of fish oil, I tell my patients, what's better than the fish oil supplements is the actual fish. So 2 oily fish meals a week will give you about 500 milligrams of the omega oils that you need to help to prevent things like heart disease. Great question.
All right,
I love this. I love that our viewers have direct access to you with their medical questions.
We are loving it. Keep sending the questions.
Keep sending it. If you do have any general medical questions, anything at all that you would like to know, just go to Twitter. It's really easy. People say, what's that? Just go to twitter.com, sign on, and then you can find Dr. Ashton at @DRJ Ashton.